Good evening, everyone, and welcome to this awareness session by Division I on breast cancer awareness. Yesterday, Dr. Muneeba sent me a message at 6:55. Now, we all know Dr. Muneeba is a very, very wise lady, but she's even wiser to know that to send a message at 6:55, 5 minutes before my phone goes on automatic silence. She's even more wiser to know that I cannot say no to her. Whatever she asks me, I cannot say no to her, and I cannot say no to Division I. So I said yes automatically without thinking, just to support Dr. Muneeba. And I even told her that it's going to be a very long night for me working on my welcome speech. But actually, that's not what happened, because by 8:30, I fell asleep on the sofa. So today morning, I woke up and I knew I only had 3 hours to write something, to edit it, and to practice. But actually, I ended up spending 3 hours listening to breast cancer survivor stories. 3 hours. I read, I listened, and I watched woman after woman telling their stories. Story after story, woman after woman, voice after voice. The same theme kept on coming up over and over again. What was shocking for me to listen over and over again, it was that it was a friend, a family member, or a loved one actually who pushed these women to go get tested, who insisted these women to go get tested. None of the, or most of the breast cancer survivors, none of them went voluntarily to go and get checked. And you know why? Because we are women, right? We are invincible. We are strong. We are unbreakable. We don't think that bad things can happen to us. We don't put ourselves first. We put our family first, and we put ourselves in the back. We think we are strong. But the fact is, 1 of 8 women, right, Dr. Muneeba? 1 out of 8 women is prone to breast cancer. How many are we here tonight in the room? 1 of 8. But you know what's ironic? As I kept on watching and researching and reading more and more about breast cancer, what was ironic is that 90% of early detected breast cancer cases are curable. 90%. And yet, 500,000 women die every year of breast cancer. 500,000. Last year, around the same time, Dr. Muneeba gave a similar session talking about breast cancer awareness. And it was in that session that I realized that I am 1 of 8. I could be 1 of 8. I also realized that I am in the high risk category because of my age, my ethnicity, my lifestyle choices. And what I did the next day, exactly the next day, I went and I booked for a mammogram. First time ever in my life to go get a test, breast screening. It wasn't painful, it wasn't shameful, it wasn't stressful. It was just cold and a bit chilly, actually. That's all. But it was very easy. And it took 5 minutes. 5 minutes of screening for a lifetime. That's all it takes. And this year, I want to thank again Dr. Muneeba for putting together another session, and Division I for putting together another session. I actually was 1 of those women who thought that breast cancer was a mumbo jumbo. I don't have time for it. But after I went tested, I became a believer. And not that I only became a believer, Dr. Muneeba, you even converted me of the importance of early testing. And because I converted and because I get tested, you may have just as well saved my life, because now I get to do it every year. And it was something that I never thought of before. So I choose to get tested every year right after Dr. Muneeba's session. Like I'm going there next week. But you don't have to do what I do. You may choose to get tested on your birthday. Maybe before you blow that candle and eat that cake, you go get tested to make sure that you're going to be there next year on your birthday, blowing that candle and eating that slice. Or maybe you choose to get tested on Valentine's Day before you kiss your loved ones to make sure that next year you're going to be kissing him again. Or maybe you choose to get tested on New Year's Day, on New Year's Eve, Christmas, Diwali, Eid, whatever works for you, to make sure that you will be here next year celebrating all those holidays. Please don't be statistics. Get tested early, get tested often. It's 5 minutes for a lifetime. Now, they say knowledge is power. And tonight, Dr. Muneeba is going to share with us the knowledge and the wisdom that is going to empower us to move forward. But you know what is more powerful than knowledge? Is the ability to take action, is the ability to do something about it. So what are you going to do after you listen to Dr. Muneeba tonight? So without further ado, Dr. Muneeba, the stage is yours. Please enlighten us.
Thank you. Thank you, Toastmaster Mariana, for that wonderful, warming welcome speech or welcome address for this event, for this noble cause, breast cancer awareness. We all are celebrating pink. You are a mother more childish than your child. That's what I always say about you. And an author who speaks, whose book speaks every inch of your challenges. But today I understood you are speaking from your heart, and without a prepared speech, you did most of my job today. That is 90% of my job, that is creating the awareness about breast cancer. You have done it so beautifully, so pinkfully, I should say. Actually, this year motivated me to conduct this campaign on behalf of Division I, supported by Dubai London Hospital, because I had an invite from Fitness First to celebrate pink, the pink party. We all ladies gathered up, we were all dressed up in pink. And just before the Zumba session or the exercise, the fitness session started, the trainer, she invited somebody onto the stage. And she told all of us to applaud for that beautiful lady. After applauding, she told she's a fighter and she's there to tell us her story of how she survived the breast cancer. She was in tears. She cried openly. We all cried with her. But only one thing she had to say: don't wait for your 40s. I was 38 when I was diagnosed with breast cancer. As just now, Toastmaster Mariana said, nobody told her to go and visit a doctor. She was thinking nothing would affect her. But she had this intuition, something is wrong, something is not right. And one of the breast cancer awareness programs she attended forced her to move to her doctor to seek for help. And she told, now here I am. I've fought all the battles, I went through all the treatment, and now here I am with you to celebrate the pink party. Just imagine I haven't been diagnosed earlier, where I would be. So on behalf of her and all other breast cancer survivors and all my patients and all those beautiful women out there, I owe this to everyone. Let's have ourselves educated about breast cancer. As Toastmaster Mariana opened, breast cancer is the most prevalent cancer in the world. Worldwide, 1 in 8 women and even 1 in 5 men suffer from this cancer. It's also the leading cause of cancer deaths in women, and the incidence of this disease is increasing exponentially in developing nations like India and China, where historically this cancer was not very common. And every October, institutions, companies, people worldwide join forces to support a common cause that encourages them to dress up in pink, coining the term Pink October. Even the buildings are lit up in pink somewhere around the world, and multiple sporting events turn into color pink when choosing the dress code. These all activities have one common goal, that is raising awareness, to raise awareness about the importance of breast cancer prevention. And helping others, that's the most blessed thing we do. It's important to think of others who had breast cancer, family or friends. It's important to reach out and to touch them. It's the kindness and warmth of what we do as humans, as physicians, what is important. And someone who had breast cancer not only endure the pain of the surgery, but the other things like psychological pain, the trauma, and the entire life uprooted and reassessing of who they are and where they stand in this world. So the key thing that you can do, it's getting tested, getting a mammogram done if you're 40 and older. Let me share my screen with you. Is it visible? Vinisha, is it visible?
Yes. Yes, it is visible.
Yes. So the October Breast Cancer Awareness Month, protect the breast, check the chest, get the test. Early detection is the best. Control your fate, don't be 1 in 8. Let's go to the epidemiology, which means a scientific, systematic, the data-driven study of the distribution of the disease that determines the particular disease. It's most common female cancer, and the second common cause of cancer death. Main cause of death is age, like 40 to 60 years. And nowadays, with the advanced diagnosis, mortality rate, that is, the death rates have declined because of early diagnosis. There's better chances of healing. And as said earlier, 1 in 8 women suffer. The incidence or the occurrence or frequency rate of the disease by age and by race, if you compare, it's more common with advanced age over 70, but still 40 to 44, 127 women in 100,000 suffer from breast cancer. If you go by the ethnicity, the Caucasians, the whites are more prone to have breast cancer. Then comes the Africans, the Asians are in the middle, then the Native Americans and the Hispanic, the Spanish and the South American people. Let's go to the breast cancer and the anatomy of the breast. As we all know, the breast cancer, we have the breast tissue. The center of the breast is the areola and the nipple, and we have the lymph nodes here. In a cross-section view, this is the chest wall, which comprises of the ribs and the muscles on which the breast tissue stays, which is more of fat, and we have the lobes, which drains into the nipple and areola. The abnormal, uncontrollable, continuous replication of cells eventually forms the tumor. And once the cancer is formed, it can even go and spread, which is known as distant metastasis. So if you see in the microscopic section, it's a normal duct. This you can see the ducts which I showed, the lobes through the ducts which opens into the nipple and areola. This is the cross section of a duct, which should be like a pipe. Inside a pipe, there should be nothing inside. When the cell surrounding starts to grow, there's a cancerous stage. And then it becomes more atypical because it starts growing exponentially. This is ductal carcinoma in situ, and then it becomes invasive cancer. Initially it's benign, it can grow into abnormal precancerous state and then malignant state, which is the cancerous state. The breast cancer spreads, we say in medicine, LLBB, to the lungs and liver, because both are the nearest organs to the breast, and to the distant part of our bodies like the brain and the bones. What are the common queries we have? What are the risk factors? What are the symptoms? What tests can be done? And when to start screening? And what are the treatment options available? And this slide shows that the cause of breast cancer, 90% is due to genetic abnormalities occurring as a part of aging. Just like our hairs turn gray, our skin becomes wrinkled, you are susceptible to breast cancer with the advance in age. And only 5 to 10% are genetic mutation related, that is inherited from your parents, from your father or mother. The risk factors. There are certain risk factors which we cannot change, like being born as a woman, the advancing age, the increasing exposure of women to hormones, estrogen, like if you have early menses, like early menarche, delayed menopause, women who take hormone replacement therapy, the race, the white females are more susceptible to develop the breast cancer, although the black females are more likely to die from the disease. These are the myths about risk factors. This we have to know because people usually relate using of deodorants, wearing the tight bras, having a breast implant, or having an induced abortion. The size of the breast can lead to breast cancer. No. Initially, birth control pills was associated with having breast cancer, but now the studies show birth control pills are no more associated with anything with the incidence of breast cancer. And getting a mammogram done, never. It is not associated with having breast cancer. How can we reduce the risk of breast cancer? Drink less or no alcohol, exercise often 3 to 5 times a week, maintain a healthy body weight, quit smoking, and getting children at an earlier age and breastfeeding them definitely prevents you from having the risk of having breast cancer. The signs and symptoms. Usually it is asymptomatic. In many cases, we don't feel anything. You have to look for it. It can be as a newly detected lump or pain, redness, the scaling, itchiness, the skin thickening, the nipple going inward, or the discharge. All these things, if you don't look for, you will not find unless it is the pain or the redness. In this diagram, we can understand more easily. It can be a new lump or a nipple discharge, or the skin changes, like the puckering of the skin or the dimpling of the skin, or the shape changes. This is what we all can do. How to self-examine the breast. So know how your normal breast look like. You can examine your breast in 3 positions: standing straight with the hands down, keeping your hands up straight, and also keeping your hands on the hips so that the chest muscles are tight. These are the 3 ways you can examine your breast. And by checking your breast, you get to know how normal your breast looks like. So you will increase your likelihood of detecting any early cancer should it develop. And remember, every woman's breast is different. So what all you have to look for: the size, the shape, is there any pain, are there any lumps, how is the nipple, is there any discharge, are there any skin changes. So this is as I said, you can do it with the hands down, with the hands up. And if you're examining your left breast, keep your left hand under your head and examine with the right hand. Similarly, you can do it in sleeping position or in the standing position. Examine both breast, the whole breast, above and below the breast, and under the arms. These are the ways you can examine. You can do up and down. You can go up and down with your hands. You can go from outward to inward, and you can go in circular motion. When we should examine, when to do it. Ideally every month, and menstruating women you can do after every menstrual bleed, and menopausal women you can do the first of every month. Even pregnant women, they should do it every month. They can keep a date on the first of every month. And it takes only 10 minutes. You have to examine the whole breast and both the breast. In case you feel anything, talk to your doctor. Because most of the swellings are benign, means they are not cancerous. And 90% of women feeling a lump, they have a benign breast disease, not a cancerous disease. So if you feel anything, talk to your doctor, and this can be treated before it turns into something cancerous. And how old should be the women to do the test? 20 to 40 years, we say breast self-examination, as how we discussed. It should be done every 2 to 3 years. Above 40 years, yearly clinical breast examination and yearly mammogram is advised. Women 70 plus years, with the breast self-examination, talk to your doctor about your screening, because maybe you will have to undergo screening in 1 year itself, you'll have to undergo at least 2 to 3 times, depending on your doctor's advice. But 40 to 70 years, definitely, we all advise yearly or annual mammogram. And what is mammogram? You don't have to feel any pain while doing mammogram, because most of them associate mammogram with pain. This is how it is done. It is an X-ray of the breast, which is taken in this position, and we can detect the cancer very early in a mammogram, even before you feel any symptoms. Even there is ultrasound, biopsy, and MRI if needed, but mammogram is the best for diagnosing breast cancer at a stage where it can be most effectively treated. Annual or biannual screening starts at the age of 40 years, and regular breast self start at the age of 20 years. Clinical breast examination at least every 3 years at the age of 20 and every year after the age of 40. As I said, again highlighting, mammogram is the best method available for diagnosing breast cancer at a stage which it can be most effectively treated. Mammography can identify breast cancer several years before it can be felt during a physical examination. Treatment modalities. There are different treatment modalities offered to patients with breast cancer depending on the age and stage of the cancer. Surgeries like lumpectomy, lobectomy, partial mastectomy, or extensive surgeries like total mastectomy with lymph node dissection, chemotherapy before and after surgery, hormone therapy depending on the biology of the tumor, whether the tumor has certain receptor like the estrogen receptor or progesterone receptor. These therapies continue to 5 to 10 years. Palliative therapies are advised in the advanced stages of cancer. So in conclusion, breast cancer is a curable disease. Simple approach like regular recommended screening tests can diagnose this cancer at a stage where corrective measures have very promising results. I would like to emphasize that the essence of womanhood is being a caregiver, but at the same time, we have to empower ourselves with tool of self-care as well. So don't ignore your health. Every year, the month of October is celebrated as Breast Cancer Awareness Month. There are many health-aware campaigns conducted worldwide during this month. So make use of this opportunity to meet a physician and get a screening done. Be aware about the changes in your body and meet your physicians if help required. Thank you, fighter. No women have to rely on luck. Thanks to technology, innovation in breast cancer detection and treatment, which continues to move forward with better detection today than ever before possible. Early detection plays an important part in saving lives, especially 3D mammogram. So do it for yourself, do it for your loved ones. Schedule your doctor visit and mammogram. And this has been supported by Dubai London Hospital, and I would like to play a video about Dubai London Hospital by the end of this session. And I have coupons provided by Dubai London Hospital for free clinical checkup, ultrasound of the breast, or mammogram of the breast.
Thank you, Dr. Muneeba, for the knowledgeable and informative session. Round of applause to you. It was very informative.